The Medical and Dental Consultants Association of Nigeria issued a 21-day ultimatum to the federal government to meet its demands or face industrial disharmony. MCDAN made this known in a communique issued at the end of its extraordinary National Executive Council meeting, which was held virtually. The communique was signed by its president, Dr. Victor Makanjuola, and Secretary General Dr. Yemi Raji. The council said it observed the non-universal implementation of commerce for all medical and dental doctors, irrespective of the agencies of the government they are working with. Joining us to discuss this development is Dr. Victor Makanjuola. He is the president of the Medical and Dental Consultants Association of Nigeria. Thank you so much, Doc, for your time here. Your association is threatening to down tools if the federal government fails to meet their demands. Has the government responded yet?
As I speak, there has been no response as I speak. And as you're aware from the communique, that basically three major issues: remuneration, extension of our retirement age for those of our members who are working in the hospitals, whose employment terminates at 60 years. And because of this very pressing demand that we're having, there's a pressing problem, there's a crisis in human resources for health globally, which Nigeria has been really affected with doctors and nurses emigrating to other countries. We have a huge vacuum in the system that is really running the ability of those who are left in the country to cope with
Doc, I'd like to hear more about your demands and what the future looks like. But right now we need to take a quick break. When we come back, we'll continue our conversation. Let's go back to our earlier conversation with Dr. Victor Makanjuola, who is the president of the Medical and Dental Consultants Association of Nigeria. Now, this association is threatening to put down its tools if government fails to heed to its demands. Doc, you were telling us earlier about these demands that you have placed before government.
Thank you very much. These demands are not new, they are not fresh. You probably will see on one of our documents that these are discussions that have been ongoing for more than 2 years. As a matter of fact, one of the major demands, the shortfall in remuneration of clinical lecturers, has been ongoing for more than 10 years. But in the last 2 years, we started engaging and having a discussion on how to remedy this situation. We have a preferred position, which the government did not agree with, and they presented their position, which we convinced our members to take as a first step in making this correction. That position was presented over a year ago. No circular to that effect has come out as I speak.
Right.
Second, we all...
Well, it would seem that Doc's connection has dropped. But we'll fix the connection, and when we have Doc, we will continue this conversation. But the reason we've been talking to Dr. Victor Makanjuola is because the Medical and Dental Consultants Association of Nigeria has given the government 21 days to heed to their demands or face industrial action. We'll get into more of that a little later. But let's turn attention to some other health-related stories. The Nigeria Center for Disease Control and Prevention says it is monitoring the new subvariants of the Omicron variant of the SARS-CoV-2 virus named EG.5 and BA.2.86. In a statement on Saturday, the health agency said its COVID-19 technical working group has been monitoring emerging variants from local to global levels. According to the statement, only one case of EG.5 has been seen in Africa so far. It has not been identified in Nigeria. The agency said preventative action remains the same as before: good hand hygiene, testing, vaccination, and the use of masks. The EG.5 subvariant has been reported in 51 countries, including China, the United States of America, the Republic of Korea, Japan, Canada, Australia, Singapore, the United Kingdom, France, Portugal, and Spain. Let's go back to our earlier story surrounding the 21-day ultimatum. The Medical and Dental Consultants Association of Nigeria is given the government, absence of meeting their demands, they would engage in industrial action. Doc, unfortunately, we lost you there. But I did want to point out that you said that you had tabled the demands to government, had conversations with government about a year ago. Nothing was forthcoming. We also know that a new administration over the last 3 months have taken over. Is it time that you probably give them a bit of respite to get into into the fray and then maybe respond to your demands?
With regards to the new government, the active part.
Not again.
These demands have been.
Doc, if you can hear us, go ahead.
Who are at the forefront of these demands and implementation of these demands. But as we speak, no action.
Well, it would seem Doc is saying no action has been taken because, the people who they had been engaging are still on the forefront of affairs. Unfortunately, we cannot continue with that because of the situation with the phone lines. But, I'm told that we could give it another try. Doc, if you can hear us, we lost you all through that you were saying. I managed to glean a few, but it would be better if you could say it again.
I was saying we have engaged even in this new dispensation with the officials of government in the appropriate offices about pushing the.
There we go again. I think we'll just.
We have senior doctors who could help stabilize.
I think we'll put a pin in this and look at it in subsequent broadcasts. Unfortunately, technology isn't kind to us today.